Hey everybody, Father Dave Wessner here from St. Michael's on the Heights Episcopal Church in Worcester, Massachusetts. I'm creating this video essentially as a public service in this time of the coronavirus crisis. Sadly, and perhaps inevitably, a member of our parish has tested positive for COVID-19, and she is in a healthcare setting. And somewhat unexpectedly, it is possible for me to be able to go and visit her so long as I follow all the required medical protocols for, of course, social distancing and also protecting myself from infection. And when I spoke to the medical staff, they asked me, of course, if I could find some way of bringing my own supplies from home, because, of course, they are short, as all medical facilities are now. So, in discussing the requirements with them, I came up with a solution based on items that I had here at home, and I wanted to share that with you so that in case you are in this role of being in ministry or care provider, or God forbid you have a loved one who is in the hospital that you have to go and visit, maybe you might be able to use these same techniques. Please check with the medical staff at the facility that you're going to. So the solution I came up with is working with trash bags. So these are just your standard thick ply black trash bags like you might have at home of a large size. And so two different trash bags. One essentially to be the bottom, to be pants. This is the top of the pants, the waist. And then at the bottom I cut two holes, of course just with plain old scissors. A little bit in from the edge of the seam, but of course with a little bit of a leg hole here in the middle. I suppose you could slit it the whole way through and just have it be essentially like a skirt or a kilt, some kind of bottom gown. But I left some leg holes in just for extra coverage. So I'm going to put this on. And of course, the advantage here is once you've got it on, now you've got a natural waistband that can be tied off. And this gives me coverage all the way, of course, from my waist down to about my ankles. So this is very good coverage for the bottom of the body. Now, next piece, and this might seem a little bit goofy, is to take what I call bread bags. So this is soft bread that you might buy in any grocery store. You fold them all the way up. Now I also want to show everybody that, of course, I've pulled up my sleeves here, and actually when I go in, they'll probably be pulled the whole way up like so. Now these cover the lower part of my arm. I'll probably end up taping that off, but I just want to demonstrate for you here. So two of these, one on either arm. And now, again, this will be much tighter when I actually go in, sealed off. And now for the main component, which is the top of the gown. And again, this is to replicate something like the very flimsy plastic gowns that medical professionals put on as they treat various patients, and those are on and off. This I just wanted to make from slightly more thicker material, just in case I wiggle around in my visit. I am not. I want to underscore this. I'm not working intimately with my parishioner. I'm not going to be permitted to get too close to her or minister communion. So I don't quite need the level of protection that doctors and nurses and aides do. So again, this is just a large trash bag, same as the first pair. And here I've cut out a head hole. So this is at the bottom. And I cut as I went, so we don't want it to be too tight because then it's going to be difficult to especially get off when I'm done, and all of the potential droplets could go all over my head and whatnot. So it's got to go on and off smoothly, but still, of course, cover as much as it can. And now as far as the arms are concerned, I thought that I might put the armholes, of course, up here near the shoulder as we would with a t-shirt to allow for more mobility. However, I also need this, of course, to cover the top of my arm as well. So it made sense actually to locate the armholes about a foot up from the bottom, so towards the bottom or maybe even in the middle of the trash bag. So I'm going to put this on. It's going to look goofy, but humility, right? That's what this time requires, is improvising. I want to be careful not to tear it as I'm putting it on. And so now, as you can see, I'm covered. Now, what I'm going to do, of course, is to take my rubber gloves. I don't have any here. Those are up at the church. I'm going to get them on my way. And, of course, put the rubber gloves in, tucking this bread bag into the rubber gloves so that I'm all sealed up. And then that should give me a pretty full range of motion and coverage from head to toe. Additionally, just one last point about masks. I read up on the decontamination, and about 200 degrees to 220 degrees Fahrenheit should be more than enough. 15 minutes. You, of course, always want to use your own mask, but we can reuse masks so long as we are very careful when we're putting it in the oven and then washing our hands afterwards and so on and so forth. To sterilize our masks. So again, 220 degrees, about 15 to 20 minutes should completely kill off the virus. In my own case, the reason I wanted to talk about the mask is just to remind folks who have beards. Just until today, I had a full beard going all the way from the top down, and of course I shaved that off. I did, however, leave my chin beard a little bit longer, my goatee a little bit longer. And I've experimented with this, so I can say that it still works. So what we actually want to do is now put this on. And this is, of course, for a very small number of people who happen to have beards, and longer beards at that. And then to kind of scoop up the beard into the mask. And you want to, of course, have shaved around that so that all of the hair is caught up into the mask. And still your nose is covered, and then you have a nice good seal the whole way around. And then this way, what this allows is, of course, for any droplets that would happen to be in the air, they don't get necessarily on your beard, which is very easy, of course, to touch, and then touch your nose and your eyes and accidentally infect yourself. So these are just some, again, improvised, homemade tips that I've experimented with, and I hope, God willing, will work. I wanted to share them with everybody for everyone's benefit. God bless you and yours in this terrible and trying time. And yes, we will get through it.